you to explore not only what we learned, but also why it matters for the future of the humanitarian action. So now I would like to welcome the session of my distinguished work package leaders, and I'm very happy that we can start. Whoever is presenting, you can also use the clicker, right? Yes, and I'm moving the second mic so you feel much comfortable. Then okay. Yes, yes, for sure. I think you can stay seated. We don't.
Thank you. We're starting. Okay. So thanks a lot for coming again. My name is Maria. I'm from People in Need. And with Anna, we will be presenting the first part of Bio4Human research we did. Okay, this is us. Okay, I think that we don't need to present anything because everything was already said by Magdalena and Anya, but still, we gathered data for what they said. So I will anyways present. So the first part was the assessment around the main question, which was who owns humanitarian waste. We tried to understand the solid waste management in humanitarian settings, and we also tried to identify the opportunities that bio-based solution can have in those settings. So we, as was already mentioned by Andrea, we had two case countries, South Sudan and DRC. And our People in Need was gathering data and focusing on the Democratic Republic of the Congo, where we are since 2008. We are implementing projects mainly in nutrition and water, sanitation and hygiene, but also other sectors. We are working in the southeast of the country, in the north and south Kivu. And our colleagues from PAH, Polish Humanitarian Action, did the work in South Sudan, where they are since 2006, right? And they are covering almost all of the country, and they're focusing also.
I will add, we've been across the whole country throughout those years, apart from ABA. But currently we are, depending on the projects, we're in different localizations.
Thank you. And they're focusing also mainly on wash, shelter, hygiene, and food security and livelihood projects, but also others. So what is, those two contexts are protracted crises. So it's not the humanitarian right after the earthquake interventions, but the needs are huge and they are very basic, the needs. So what is common for both of the contexts is that humanitarian organizations, as was already mentioned by Anya, are focusing mainly on providing the basic needs, even life-saving in terms of nutrition, for instance, in the DRC. And the solid waste management might be, I don't want to say forgotten, but not prioritized. What is typical in those countries is the lack of the infrastructure for solid waste management. So the institutions are extremely fragile to tackle it, and the communities are bearing the weight of it, the impact that was already discussed already. So we try to understand what is the main solid waste management challenges in those two contexts, how it works, what does happen with the humanitarian waste when it comes to the context and enters the waste streams that are already there, and what might be the opportunities. So I wanted to show you these typical images also for you, those in the room that are familiar with humanitarian context, to think about your context, and then we can compare and discuss what might be the opportunities in different contexts. So basically what we did in terms of methodology, we started the whole project by stakeholder mapping in DRC, South Sudan, and also in Europe. And we focus on different stakeholders. So the approach was multi-actor. We focus on policymakers, humanitarian actors, businesses, academia, and local communities. And when I say academia, businesses, it's both European and local. So, we can later work with them better. You can find those databases on Zenodo. There's a QR code that you can scan and access. So our aim within Bio4Human was also not to get the findings only, but to come up with methodologies that can be replicated if you want to do your assessment or any type of work with solid waste management. So everything will be accessible. The needs assessment per se was divided into a desk review of different literature, gray literature that's already there on solid waste management, different contexts, etc. And we did a qualitative survey of 29 humanitarian actors. We wanted to have much more, but it's really hard to get humanitarian actors to do these surveys because they are so overwhelmed. We did quite extensive field work. We did focus studies and key interviews with mainly policymakers, humanitarian actors, businesses, and local academia. And the focus group discussions were mainly with local communities and representatives. And now I will hand over to my colleague Anna, who will present the findings.
Maybe.
Yeah, I will move it.
So that I don't have to scream too much. Okay. So basically, the challenge of a humanitarian waste is that solid waste management is generally not a concrete agenda topic or a specific responsibility within humanitarian organizations. It is often viewed as something that's additional, that requires some extra resources and time. And these are very hard to find basically in the very complex settings that we are working with, and also with the short, usually very short lifespans of different humanitarian projects. So at the same time, the humanitarian waste doesn't disappear, but enters the local waste streams that are already overwhelmed. And we are all talking about settings that were already described by the speakers before me, but basically the formal collection infrastructure is minimal or absent. Imagine like few waste bins, very limited transport capacity, almost no valorization or treatment facilities to speak of. And if they're on small scale, artisanal level. So what exists is basically fragile, underfunded, and already overwhelmed from the pre-existing local waste that is there. So the result is that waste, including humanitarian waste, is then openly dumped on the streets, in water canals, or burned. And where dedicated landfills exist, they often look like what you can see behind me on this picture, which is a picture we took in one of the landfills in Bukavu. So you can see that they represent a serious public health and environmental risk. So building on what I just described, we identified during the needs assessment several critical gaps that cut across both contexts. And you can read the rest of them because I will mention just three due to the limited time. You can find the rest of them in our report, Deliverable 3.3. If you are interested, or I saw there is a full list, I think, on one of the printed materials on your desks. But first, I would like to mention that solid waste management systems are underfunded and under-resourced, both within the humanitarian sector, but also humanitarian contexts. So, as mentioned, solid waste management is rarely a dedicated responsibility within humanitarian organizations that place priority on maximizing direct support and assistance to most vulnerable populations, what we call life-saving activities. On the other hand, there are also the local governments that face multiple competing priorities, and that leads them to dedicate the already limited resources that they have to the most immediate priorities, basically. Second, local solid waste management systems often lack the capacity to adequately manage many types of humanitarian waste and packaging. So valorization and disposal facilities for materials like plastic either don't exist or fall short of basic environmental and health standards. And it's the communities that are basically left to manage the consequences. And although vulnerable populations see waste as a resource to an extent, for example, they reuse bottles to sell locally produced beverages, or they may burn plastic as a fuel for cooking. Still, waste proliferation ultimately contributes to injuries, to spread of rodents, insects, and diseases. So the good news is, though, that awareness is growing, as we have heard, and also actions are being taken. So at the global level, we've already heard that we have like standards that address solid-based management, such as sphere standards or core humanitarian standards, do no harm principle, for example. Key donors like DG ECHO require environmental screening as part of shelter and WASH projects, project assessments and implementation, and with solid-based management as one of the cross-cutting issues. And humanitarian organizations themselves are also increasingly adopting green policies, such as green procurement policies, to reduce their environmental footprint. And in fact, most of the surveyed humanitarian organizations indicated that they are looking into their environmental impacts of their operations and their logistics. At the same time, there are also some actors at the local level, mostly private sector, that are trying to run some initiatives of solid-based valorization. And the communities themselves are also increasingly aware of the negative impact of unmanaged solid waste on their health of their children, and also on their livelihoods. So all of these are some foundations we can build on. And now I will give the word
to me. Okay. I don't know if it works.
Okay. Say something.
Hello. Okay, works. Perfect. Okay, my name is Damian Kuznowicz. I'm from ProCivis Foundation from Poland, and I want to present you today maybe the process of selection of bio-based solutions within this project. So we are responsible for this. So maybe just as a background for my presentation, what already has been said today. So the humanitarian organizations are delivering help, aid to the crisis areas, let's say, but it has to be like transferred somehow there. Okay, so the ways are like necessary, and they are part of the business here. So as you can see, maybe the numbers here, the problem is quite big, is significant, and what is important also for me that humanitarian organizations actually see this, because over 80% of humanitarian organizations see it as a problem, the packaging waste and the plastics. So this was like the initial background for our work. Thanks to needs assessments, we have received a number of interesting data, including what bio-based solutions was already implemented, what should we focus on. We were working together on the criteria. So yes, so having in mind implementing bio-based solutions, I also want to highlight some challenges related to this. So lack of infrastructure, maybe knowledge gaps, maybe some social barriers, maybe a bit of lack of cooperation between different actors. So in terms of thinking of bio-based solutions being implemented there, we have to have in mind all these like challenges, gaps that has to be tackled. So maybe I want to describe the process of how actually we did select the bio-based solutions for the further analysis. So we started with really open-minded process, really broad. So we had 5 investigation lines, which basically means the sources of data that we are analyzing. So we had a bio-based industry consortium survey. We closely cooperated. We consulted the industries. R&D projects, mainly CBJU projects. So the project that actually delivered maybe some innovative products, processes, and so on. We also analyzed the patents, the different online resources. It means, for instance, organizations that support implementing bio-based solutions. So different kinds of data, and also like the winners of maybe some EU trade fairs related to innovation or bioeconomy, which also like was a kind of interesting analysis to do. And we also have some additional solution from our partners in University of Cantabria. So basically, we did this everything sum up to 81 solutions, and it was very different like solutions, different technology readiness level, different data available on the solutions, different descriptions, and so on. Every solution and all those solutions were clustered in 7 groups in order to make it in some kind of order for further analysis. So was the step 1. And as you can see, there were few steps more. So the next step was like the internal analysis within our consortium. So we took this kind of criteria of is it applicable in humanitarian settings? Is it resilient for climate conditions, for instance? The scale of investment, and also the fourth point was also important, the cooperation with the owner of the technology, because if we would need to analyze this product, this process, and so on, we needed some additional information from the owner, and to have the evidence. And it wasn't always the case. So some of the owners didn't want to cooperate, maybe, but it helped us to even narrow the solutions to 32. And the step 3 was also really interesting because this was like internal, maybe, and external consultations with humanitarian actors. So we had of course, people in need, Polish humanitarian actions, but also we invited other humanitarian organizations like World Food Program, I think, International Red Cross. And it was really important for us to see the point of view of the organizations that actually work in the field, and it also highlighted maybe, and they assessed maybe the solutions from the point of view of feasibility, the demand from humanitarian actions, like different points of view that help us to extract more of the solutions, and we stayed with 27 solutions. So as you can see, it was like a process of really broad selection from number of sources, with each layer of filters of expertise, just to select the right ones that can be transferred to further work for further analysis. So life cycle assessments, social LCAs, life cycle costing. So yeah, and maybe really briefly that because it was like done in the following work packages, but the the solutions were clustered in several reference kits. So the kits, it means that the kits, it's like the typical type of maybe help that was provided in the regions. So it was non-food items, wash items, so hygienic processes, products, and also food basket and agriculture kit. So, and it helped us to create the reference scenarios in order to analyze the substitutions maybe of the items in the baskets with the bio-based solutions. But it will be probably described soon. Yeah, and in terms of consulting the bio-based solutions with the communities, there were 10 solutions of bio-based solutions that was actually consulted in the field, which was really also helpful and helped to create the community engagement report. Okay, so thank you so much. I will stop here.
I think it's good. Oh, yeah. So I'm Perrine Sébastien from WeLoop. So we were the company responsible for the life cycle assessment, the social life cycle assessment, and also life cycle costs. And so here, based on what Damien and the other partners presented, I'm going to show you what the environmental assessments showed and how we arrived to these results. So to assess the environmental impacts of the bio-based solutions, we need to look at the entire life cycle from the production to the use and to the end of life. So on one side, we have the current situation where we mainly use fossil-based products that are coming from fossil resources. After the manufacturing and the distribution, it's used, and then there's the issue that at end of life that was presented by the previous partners. And then we have the possible introduction of the bio-based materials. And then at end of life, it can also provide multiple options where we can have biodegradable materials that then can be treated by industrial or home compost, but also with other end-of-life technologies such as anaerobic digestion, by black soldier fly technology, which also provide not only waste treatment, but also co-products that can be interesting for the local communities. But the issue here for the life cycle assessment is how can we compare both of these scenarios? So here, the first step on our side was to really understand what do we need to assess and how. So we looked at the entire life cycle. We did not look only at climate change, which is the most common environmental impact we think of, but there's also a lot of other impact categories, such as resource use on one point and other. And so for this, we use the European methodology for impact assessment. And then we needed to compare these bio-based solutions with their conventional material today. So here we needed to define a function for each of the items that we wanted to replace. So the challenge was then to define a quantity of materials that needs to be used to fulfill the same function. So here are a few examples with the solutions that we have analyzed throughout Bio4HUMAN. And for instance, to have 6 liters of oil distributed, we need on one part 2 bottles of fossil-based, 2 bottles of fossil-based material, and then but 3 bottles of PLA because PLA bottles because they are less mechanically resistant. So this was the idea. And so how do we conduct an environmental assessment based on this? So then we modeled each of the production process and end of life of the products, and we managed to have the impacts for 1 kilogram of each of this material. Then, thanks to the reference flow, so the quantity of materials that we have defined ahead, we could assess the actual environmental impacts, thanks to which we could compare between fossil-based and bio-based. For this, we focused on the following indicators that for us meant most sense in terms of bio-based solution and its possible challenges. So we focused on climate change, but also all that is related to agricultural activities. So the possible eutrophication, the ecotoxicity, the use of water and of land, how also can it lower the use of fossil resources, and so on. We also went above and we looked at the effects of microplastics. If the plastics leak into the environment and are not treated, what is the actual impact of the microplastics on the environment? And also we looked at how bio-based solutions can store carbon from the atmosphere temporarily, as they are made from plants which can capture CO2 from the atmosphere. Based on this, here is one of the results that we have, where we can see on the left that we have around 35% of the impacts that come from the end of life for the fossil-based materials, and only 65 that come from the production. And then if we look at the bio-based material, thanks to that, we have most of the impacts that come from the production phase. But at end of life, thanks to composting, it's really low. So this this shows that biodegradable solutions really allow us to lower the impacts locally, because at end of life we're not going to have that much issues than in the current situation. So this is also a way to show that the biodegradability is key to reducing the impacts, and especially in humanitarian context where we need to have this solid waste management, that it's implemented in a more easy way, though, let's say, to avoid open dumping and open burning. So in the end here, we can see a lot of graphs, but the idea here is to is to show for each of the items on the kits what is the impact, environmental impact difference between the reference fossil-based material and the bio-based solutions that we have identified. So out of this study, we could, to focus on the positive, we saw that the most promising solutions were the packaging that were dedicated for lightweight items. For example, seeds, dried legumes, and also like clothes and everything, and delivered in small quantities. This is really interesting because when it's too heavy, then we need a lot of material, and this could become an issue. We also saw that the mosquito net solution was quite interesting, such as the disposable sanitary pads that are entirely biodegradable, and also some solution for tape to a lesser extent. What I want to add here also is that, considering that most of the impacts of the bio-based solutions come for the production, as it was said before, the durability of the materials is quite interesting to make the lifespan longer, and so that the items can be useful for a longer time, and then it could really improve the environmental impact reduction. And you can see all of these results in the deliverable here, and also some few policy recommendations in the annex that can also help go through all of this analysis here. And then I leave the floor to Anna.
Okay, thank you. Can you hear me? Great. All right. I'm sorry I will be reading some of the things because it is a complicated subject and a lot of smart people worked on it. So I want to make sure I will present as much as possible. A lot has been done, as you can see. And then in the work package 6, we started to question is whether the bio-based products work and if they will be adopted. We conducted different analyses. One of them was governance and socioeconomic analysis, where we focused first on governance, where on the existing legislation in the case study countries, on taxation, environmental legislation aspects, international existing standards. Then we moved to socioeconomic analysis, and we used social life cycle assessment, followed UNEP and SETAC guidelines. We included 18 different social impact categories. We assessed impacts across multiple stakeholders, beneficiaries, children, employees, workers, local communities, society, supply chain actors. And the conclusion was that overall, improving social performance requires greater transparency, stakeholder engagement, and governance alignment. Then humanitarian organizations seems perform consistently well across key social themes, and the product level and supply chain transparency of products remain limited. After that, we moved to life cycle costing, where we used life cycle perspective to assess costs for from production to delivery. So production, transportation, storage. We conducted, we took information from a humanitarian organization perspective. So what was the decision-making focus? We compared it with bio-based versus conventional items within standard humanitarian kits. And our consortium colleague, also created an Excel tool that is scenario-based, that is allowing parameter variation. So the transport mode, packaging, and context to further assess it and replicate it. This tool is enabling, and this part of life cycle costing was enabling more comparative analysis rather than precise cost forecasting, but it already gave us some insight. Later, we also did community engagement study. So we spoke to various stakeholders. As you can see, it was 77 of them in DRC and South Sudan. As previously, it included business, academia, humanitarian organizations, communities, donors, and authorities. And those voices from the countries that we were conducting the analysis allowed also for active participation in the research of the whole community within the countries we were working in. I will later say a little bit more about it. And we also tried to put all the information in the final policy brief. So we managed to gather their different recommendation with division by stakeholder that we want to potentially ask to address those barriers and enablers. So it is divided by humanitarian organizations, bio-based sector, national, local policymakers, international policymakers such as European Union. And we also did SWOT analysis. So we wanted to focus on long-term development of the biosector outcomes by assessing strengths, weaknesses, opportunities, and threats that came up from previous analysis. Okay. So what did we hear from the communities and humanitarians on the ground? One of the, we heard a lot, but let me try to be brief. Knowledge and awareness raising is like on all levels is needed. We could see interest from all groups because across all stakeholders, they were positive and hopeful as waste is a big problem in those contexts. But I also think that in our context in Europe, it's also a big one. Lack of knowledge and understanding was one of the key points there. So depending on the stakeholder, the missing knowledge was different. But anyway, it was significant enough to influence responses that often focused on asking our staff more questions to get more information before they are able to answer. It was also visible, I think, in our consortium, because we do not often meet in such sectoral setup. And it showed how valuable it is to have multiple perspectives and expertise. End-of-life infrastructure is the binding constraint. I think that we were talking about it a lot throughout this presentation, but we see that the waste is not being managed properly in the 2 case study countries. Almost no formal dumping sites exist, and even the ones that are approved, they were not managed in a way that would allow for better environmental impact. It is a complex topic, and requires ownership of the community and authorities, as well as knowledge and big funding. And solutions existing on the market were often made for contexts with better solid waste management systems. Communities need to see, touch, and try. So the point is really related to knowledge, but also looking at our examples. We saw that many variables influence the positive outcome of different solutions. It is important to have them presented and tested in the very specific context, because even between our countries, there were some differences. And if we compare it with other humanitarian contexts, completely different outcome might be presented. And the cost is a real concern across all stakeholders, but it is not decisive. So it was sometimes very hard for people to understand that we talk about humanitarian waste only within this particular research. And they immediately were thinking about waste generally and the whole solid, sometimes even liquid waste management system in the country. And for example, community was worried if they will have to pay for the potential price increase. Humanitarian organizations were also looking at the cost per beneficiary, and if this kind of changes will affect the decrease number of people that can be supported. But later in life cycle costing, we could see that bio-based packaging has a limited impact on total kit costs, and packaging is a small cost share. The cost increases remain moderate in most kits, except in specific cases, and major cost drivers are core items, kit items, so not packaging materials. Yes, where bio-based solutions can fit. Obviously, we came to the conclusion humanitarian procurement is the most promising, but because they are controlled by humanitarian organizations and donors are supportive of different environmental changes in the system, but we need standards. So standards in humanitarian organizations and in humanitarian procurement, they need to be upheld. So that's why for bio-based sector, we need them to test their solutions and certify according to humanitarian procurement rules. Another possible fit is institutional and medical use. So this is a niche entry point that we see. Looking at the majority of medical waste that is being incinerated in our context, they are not being incinerated in the very sophisticated technological incinerators. So all toxic fumes and residues are being released to the environment. So change in this sector would create some added value. Then general community use. This is the most difficult because it requires change on various levels and solid waste management. And to maybe be a bit more bright at the end, there are already existing bottom-up initiatives. So scale up is needed. We saw that there are technologies and solutions that community businesses or humanitarian organizations are already using. And depending on the type and context, there are different barriers and opportunities to scale it up. And what is needed for adoption and scaling of bio-based solutions? I want to invite you to read our final policy brief because we tried to squeeze there a lot of information, but what we see is the field-based testing solutions for the specific context and scaling up existing and tested solution. Scaling up existing and tested solutions is important. s- 2 minutes. Yes, I am finishing. Then waste management must be a part of this conversation, which we already talked about. It is a whole of society effort. And the bio-based industry and humanitarian sector and other stakeholders need to talk, because we could see that they do not understand each other very well. And once they talk, it starts to show completely different perspectives, and that we need to discover and mainstream circular economy in practice, because we can see that bio-based solutions are already, in essence, being used in humanitarian world, but knowledge sharing, awareness raising, and appropriate context adaptation, along with incentives, are needed to support the adoption of circular economy approaches. Thank you. It's okay.
Thank you very much, and I feel free to sit here. All good. I will move to our next speaker from Warm Project, and then we take the questions, because our next speaker